In this educational video, we will be talking about how to manage your asthma. Please bear in mind that this video will be covering asthma management in adults and that it differs slightly from how asthma is managed in children. Asthma is a common long-term condition that affects over 300 million people worldwide. In the UK alone, 5.4 million people are affected by asthma, meaning that 1 in 11 people are affected. Every year, the NHS spends around £1 billion on treatment and care regarding asthma. In 2014, over 1,200 people died as a result of asthma, and in order to prevent that as much as possible, it is vital to manage asthma to the best of our abilities. The aim of this video is to explain how asthma is managed. There are 5 stages to asthma management, and your doctor will let you know which stage is suitable for you. In this video, we will be looking at each of these 5 stages one by one, and we will also discuss non-medical ways in which you can manage your asthma. Please note that these 5 stages are not mutually exclusive, and you may be on more than one of these stages at once. Everyone who has been diagnosed with asthma should have one of these. To start off with, let's take a look at the components of this inhaler. As you can see, there is a canister inside. This canister contains the active drug which will relieve you of your asthma symptoms. Also, this is the part which you put in your mouth from which you then breathe in. Please note that there is a separate video clip showing the correct method for the use of an inhaler, and you can find this as part of this series of video clips. Now, to go through stage 1 of your asthma management. Simply put, stage 1 is using your blue inhaler in order to manage your asthma symptoms. The blue inhaler contains a drug which acts as a short-acting reliever. In asthma, your airways might begin to tighten up. As a result, this might cause you to cough, wheeze, feel like your chest is tight, or make you feel like you're short of breath, particularly at night. What the blue inhaler does is that it causes the airways to loosen up, thereby relieving you of your symptoms. The blue inhaler should be used when required, and most people use it around 4 times per day. Stage 2 of asthma management is the use of the brown inhaler. In asthma, your airways can become inflamed, and this can lead to worsening of your symptoms. The brown inhaler contains a steroid which reduces this inflammation and is therefore used to prevent your asthma symptoms from occurring. The brown inhaler should be used twice a day unless your doctor tells you otherwise. Stage 3 consists of a combination of stages 1 and 2, but with stronger drugs. So instead of having blue and brown inhalers, you will have a green inhaler and an orange inhaler. These do the exact same things as the blue and brown inhalers, but are more powerful. They are used by asthmatics whose symptoms cannot be controlled with the blue and brown inhalers. They are used daily, and your doctor will advise you as to whether or not you need to use the alternative green and orange inhalers. Sometimes, instead of being given a green and orange inhaler, your doctor may give you either a pink or a purple inhaler instead. Again, these do the same things as the other inhalers, and your doctor will advise you as to which one is most suitable for you. Stage 4 is in the form of tablets or capsules. They are called theophylline. Theophylline are useful as they have a dual effect of both relaxing your airways and reducing the inflammation in your airways. They are long-term medications that are to be taken daily. They are only given to asthmatics whose symptoms cannot be controlled by the previous 3 stages. Again, your doctor will be able to advise you on whether or not they are suitable for you. The final stage of asthma management is the continuous or frequent use of daily steroid tablets or the administration of oxygen via mask, which is normally carried out in hospital. This is only indicated to people who are unable to manage their asthma after trying all previous 4 stages of treatment. The way in which an asthma attack is managed can be slightly different. The term asthma attack refers to a sudden worsening of your asthma symptoms caused by excessive tightening of your airways. They can occur spontaneously, and symptoms include being unable to complete a sentence in one breath, very rapid breathing, harsh wheezing when breathing, and a lot of coughing. Asthma attacks can be life-threatening and should be managed immediately. In the case of an asthma attack, you must refer to your asthma self-management plan. This is something that your doctor should have gone through with you and contains instructions on what to do if you feel that you are having an asthma attack. If that doesn't work, then call 999 immediately. Please note that there is a separate video clip that shows you how to manage just an asthma attack. You can find this as part of this series of video clips. So what do these asthma medications actually do to your airways? Let's demonstrate this with this diagram. Normally, the airway is nice and wide, so that breathing is nice and easy. However, what happens in asthma is that your airways can become narrowed due to the muscles of the airways constricting, therefore making it more difficult to breathe. What your inhalers and other medications will do is that they will cause the muscles to loosen, and therefore your airways will expand back to normal, thereby making it easier to breathe again. So far, we have talked about how your asthma can be managed using medications. But what about anything extra that can be done, not including the medications given to you by your doctor? Well, for starters, if you are a smoker, then it is advisable that you stop. Tobacco smoke is linked with a worsening of your asthma symptoms. Exposure to other air pollutants such as car exhaust fumes and strong perfumes can also worsen your asthma symptoms. Breathing in cold air can also make you wheeze, particularly after prolonged exercise. Your diet is also linked to your asthma. Greater consumption of fruit and vegetables has been shown to be good for your asthma. Some studies have also shown that weight loss in overweight patients can improve your asthma symptoms. So it is highly advisable to start regular exercise if you don't do so already. Breathing exercises have also been shown to be of benefit in reducing asthma symptoms, which can be physiotherapists taught. So should you like to learn more about them, please contact a physiotherapist. We at Peterloo Medical Centre would like to thank you for watching this video, and we hope that you have benefited from it. If you have any questions at all, don't hesitate to book in to see your doctor. Thank you very much.